Speaker recognizes Minority Floor Leader Lasinski.
Thank you, Madam Speaker. I rise today to urge a yes vote on this amendment to bring home crucial COVID relief funding from DC. We're actually approaching the 1-year anniversary of this funding being allocated to us under the previous administration on a bipartisan vote to help us move swiftly through this pandemic. These dollars, $330 million, continue to gather dust in DC, continue to sit there while we battle the pandemic here. These dollars, as all dollars from DC, typically have strings attached, and these dollars are to specifically be used for testing, vaccine distribution, and helping us ensure our population and people and family and loved ones are safe. So where are we right now? Why does this still matter? It still matters because when I look at the news every morning, the headlines, Michigan adds 16,530 cases, 358 deaths from COVID over 2 days. These additions now have brought our state totals to over 1,300,000 confirmed cases, 24,090 deaths. We're averaging 8,265 cases over the last 2 days. Hospitalizations, the next article. Hospitalizations have broken records this week. As of Wednesday, as of yesterday, there are 4,452 adults hospitalized with confirmed or suspected cases of the virus, as well as 64 children. This is up over our previous record of 4,390 adults and 57 children hospitalized just on Monday. We're hearing from Spectrum Health in West Michigan, the Healthcare Association of Michigan, AARP, Michigan Assisted Living Association, Primary Care Association, testifying in our committees, pleading for us to help and do more. Bronson, South Haven, Ascension, and Standish, Detroit Receiving Hospital, Mid-Michigan Medical Center in Alma, ProMedica in Coldwater, ProMedica in Monroe, Spectrum in Hastings, St. Joseph's, Mercy in Ann Arbor, and Livingston are at 100% capacity. What this means, when members of our community need a procedure, need a breast biopsy, need something done, the beds are full and people are being turned away. And yet we continue to leave hundreds of millions of dollars in DC. We know that our nurses need to be nursing, our doctors need to be caring for people. We need these dollars for vaccine distribution to help get folks out there with injections. We need our kids in school. We need them in school every day, learning in the way they can only learn when surrounded by other children and with loving teachers at the front of the classroom. We need test-to-stay protocols in place in our school. We have school districts who can't find tests, but we have $330 million for those tests sitting in DC. We have businesses who are coming to us, coming into our offices, coming into our committees on a regular basis, asking for help and support with testing, asking for help and support with vaccine distribution, to make sure that their customers feel comfortable coming into their business establishments, to ensure that they have healthy employees there every day, to make sure that small businesses have a burden that is lifted, that we can lift now with these dollars, that we could have lifted a year ago, December. And we've let businesses struggle. We've let children be kept out of school because we're not willing to put these dollars to work in Michigan. We need consumers to have confidence that they can eat and shop through this holiday season. We need families comfortable that they can send their children to school where they can learn and come home healthy, that they can visit family over our beautiful winter holidays that are coming. Make no mistake, more Michiganders could lose their lives without this funding. We're turning our backs on families, businesses, schools, our entire community, as our hospitals are full and we refuse the dollars that are here for testing, tracing, prevention, and support for so many. Now let's be clear, we have a lot of federal dollars in front of us. A lot of opportunity to make generational change. But we haven't finished what we began. We haven't done what we needed to do from a year ago, and those dollars and those changes won't be nearly as effective. when our state is left devastated, our hospitals are left full, and disease is allowed and preventative care are allowed to go uncared for outside of the COVID crisis. So I'm calling for a yes vote on this amendment to bring home this $330 million for COVID relief and to show Michiganders that we are in their corner. And Madam Speaker, pursuant to Rule 30 and Article 4, Section 18 of the Michigan Constitution, I ask my colleagues to stand with me as I call and request a record roll call vote on this amendment.
The Minority Floor Leader asks for a record roll call vote. Record roll call votes require support. Is there support? There is not support. The question is on the adoption of the substitute. The clerk will open the board. The substitute is not adopted. Are there further amendments? There are further amendments. The clerk will read.
Representative Howell.